All right, welcome back to ABA exam review and the latest set of RBT exam practice questions where we're going through the set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack and practice exams. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Kenny attempts to climb on tables at daycare. When he does this, the team lead in the daycare room says, "No, Kenny, we don't climb on furniture." Kenny no longer climbs on tables. Kenny no longer climbing is a result of what? All right, so we've got what appears to be a consequence question because we're looking at whose behavior? Kenny's, and that's the first thing you always want to do in behavior questions is identify whose behavior are you looking at. And so we're looking at Kenny. And what is Kenny doing? Well, he's no longer climbing. So he at one point was climbing on tables at daycare. Now he's not. And so what has happened to his behavior? Has it increased or decreased? Well, clearly it's decreased. So as soon as we think decrease, we have to think extinction or punishment because reinforcement increases behavior. And since Kenny's behavior is decreasing, we're thinking extinction or punishment. Now, what is the difference between extinction and punishment? With extinction, we're withholding reinforcement. With punishment, we're actually adding something or taking something away as a consequence. In this case, Kenny climbs on tables. As a result, the team lead in daycare says, "No, Kenny, we don't climb on furniture." So the team lead is reprimanding or redirecting or instructing Kenny, however you want to say it or see it, as a consequence of him climbing on furniture. She's adding this verbal reprimand or correction as a consequence. So when we add a consequence, we consider that positive. And since it's decreasing Kenny's behavior, to me, this looks like positive punishment. Now, what's interesting here is if you look in our answer choices, we don't have positive punishment. So what do? Well, let's find the next best answer. We know it's not A, negative reinforcement. We've already eliminated reinforcement because the behavior decreased. We know it's not negative punishment because the consequence was added, so it can't be negative. It's going to be C, conditioned punishment. And why is that? Well, because this verbal statement, which decreases behavior, isn't unconditioned. At some point, this statement had to be paired with other punishing stimulus or stimuli to receive or establish punishing properties. So this is a result of a conditioned punisher. Remember, unconditioned punishment are things like hunger and pain, things that don't need to be paired, right? They're already just punishing from the very beginning, from the day you're born, these things are going to be punishing. Somebody telling you don't climb on furniture, that has to be conditioned over time. So Kenny no longer climbing is a result of conditioned punishment. Very good example of a question where you can predict the answer up front. And even if you don't see it, well, what's our next best answer, right? We're always looking for the best answer. If we can't find it, what's the next best answer? A behavior technician implements an extinction procedure while working with their client in the clinic. The target behavior is spinning. When they are in the home session, the behavior technician is instructed to not implement extinction, but to instead implement a different intervention. The spinning is now happening more often at home. What is the most likely reason for this? All right, long question. Let's slow down. We're not going to jump to the answer choices. We're going to understand what the question is asking and saying. The question is asking the most likely reason that the spinning is happening more often at home. So what do we know about the spinning? What do we know about the environments? We know the technician is implementing extinction with the client in the clinic. Okay, so in the clinic, we're using extinction on spinning. At home, the behavior technician is not using extinction, but is implementing a different intervention. So in the clinic, we have extinction. At home, we're using something different. Now, if you've been working on your vocabulary and you're becoming fluent, what term do we think of when we think of two different environments and the behavior changing in one environment and then going the opposite way in the other? In other words, if the spinning is now happening more often at home, it's a pretty good indication that extinction is effectively reducing it in the clinic. And what do we call that? When a behavior, let's say, decreases in one environment and increases in another. What do we consider that? A, the behavior has been reinforced accidentally in both settings. Well, that's probably not the case, right? Because one, the behavior technician is implementing extinction in the clinic, and if the spinning is now happening more often at home, it's much more likely that B is occurring, behavior contrast. Now, what is behavior contrast? Well, behavior contrast is when the behavior changes in one setting and then goes the opposite way in another. And the reason that usually occurs is the intervention is different in one setting than the other. That's exactly what's happening here. We're using extinction in the clinic, something else in the home. As a result, the behavior is changing in different ways, and the spinning is now happening more often at home. What about C, the PREMAC principle? Well, PREMAC principle just says you're using the opportunity to engage in a preferred response as reinforcement. We're not implementing the PREMAC principle here. We're not discussing reinforcement procedures. C is out. D, the behavior is being punished in the clinic. Well, it's much more likely the behavior is decreasing at the clinic, but due to the extinction procedure, because we're already using an extinction procedure, there's no indication that punishment's occurring. Based on all the information, the fact that we're using two separate interventions in two different environments, and in one environment, the behavior is now happening more often, that is a clear indication that there's likely behavior contrast occurring. A learner received a set of Duplo blocks for their birthday. The learner will put the block in their mouth and laugh whenever the parents tell him, don't do that. The learner has never swallowed the block, but the blocks are small enough to pose a choking risk. What is the most appropriate intervention to start with immediately if you do want to target this skill for decrease? Okay, again, long question. Don't jump to the answer choices. Let's understand what's happening here. Let's try to predict an answer. We're looking for the most appropriate intervention to start with immediately, keyword immediately, if you do want to target the skill for decrease. And so what are we targeting for decrease? Well, we're going to target, obviously, the learner putting block in their mouth and laughing whenever the parents say, don't do that. This is an issue. And why? Well, even though the question says the learner has never swallowed the blocks are small enough to pose a choking risk. That should immediately jump out to you because our first rule and our number one thing is we do no harm. We pose no risk to the client. We keep them safe at all times. As soon as you see something like they've never swallowed the block, but the blocks are small enough to pose a choking risk, that has to jump out to you. That is the first thing we must address before anything else. And that's why it's important that you pick up on this word immediately, because we do want to decrease this, but before we do anything else, we've got to keep this client safe. Just because they've never swallowed the block doesn't mean they won't. And since the blocks are capable of being swallowed, that's a big deal. We have to start there. So what do we do first? The parent should put the block in mouth on extinction and say nothing. Well, what's the problem with that? Well, if they're putting the block in mouth on extinction and saying nothing, are they just going to let the child put blocks in their mouth and laugh? We know it's a choking risk. A seems very unsafe. We're not acting in the best interest of the client. A is out. B, the parent should take away the Duplo blocks for good. The problem here is if we take away the Duplo blocks for good, the client can no longer engage in the response that we want to decrease. And if you don't give them an opportunity to engage in the response that you want to decrease, you can't. You can't decrease it. So you've got to give them the opportunity. B, sure, solves the problem temporarily, but we don't want to take away the blocks for good because eventually we do need to teach them to not put them in their mouth. C, the parent should block any attempt to put blocks in their mouth that the learner makes. Yes, this is where we have to start. For now, anytime you see them about to put a blocker in their mouth, you have to stop that attempt. And the difference between B and C is with C, they can still engage in the response and we can stop them. B, they cannot because the blocks are gone. So with C, there's still a possibility for us to decrease the behavior. At least with C, we're to the point where we're going to keep them safe first and then move forward with a different intervention. D, the parent should reinforce the learner when they were playing with another toy and not the Duplo blocks. D kind of has the same issue as B, where we still want them to engage with the blocks because we're trying to decrease this behavior. And if they're not engaging in the blocks, we can't decrease the behavior. That's a problem. So B and D have the same issue. C still allows them to play with the blocks. Now we're just going to keep them safe, make sure they don't put the blocks in their mouth while we work on developing another intervention. This is I would say, a more advanced question. So if you picked up on it, fantastic work. If not, don't worry about it, right? We're learning. Go back, review, and see what did I not understand the first time. You, a behavior technician, are asked by your supervisor to give your opinion on the length intervals in a partial interval recording system. Your supervisor gives you 4 choices of interval length: 10 seconds, 15 seconds, 20 seconds, and 25 seconds. Which length would be most sensitive to behavior change? All right, another more advanced question. That's good, right? We want to challenge ourselves. What is the question asking about? Let's start there. Well, they're asking about the length of interval that's most sensitive to behavior change. And that's the key phrase. What does it mean to be sensitive to behavior change? Well, let's think about that phrase. If I'm sensitive to something, I'm affected more by small adjustments or small changes, right? I'm more sensitive to something in the environment. I'm more receptive to when that occurs in the environment or when the change happens. So in other words, in behavior terms, when we're sensitive to behavior change, smaller changes in behavior are picked up more frequently and are much more likely to be picked up. Now, with that said, you are using a partial interval recording system, meaning the behavior only has to occur for a split second, right? And so if you're going to pick a choice of interval length that's going to be most sensitive to behavior change, in this case, it's likely going to be the shorter system, right? Because with the shorter system, there's much less chance for the behavior to occur in the interval recording system. So that change is going to be much more noticeable or sensitive with this shorter interval. You organize and conduct a multiple stimulus with replacement preference assessment using 6 different items. You conclude as a result that your client has high preference for 2 items, medium preference of 1 item, and no preference for 3 items. What have you identified as a result of your assessment? Now let's think about this. We are using a multiple stimulus with replacement preference assessment. So we have 6 items. And how do we run a multiple stimulus with replacement? Well, you take the items, whatever item is picked, you put back, and you replace the other 5. As a result, you found out your client has high preference for 2 items, medium preference for 1, no preference for 3. So all that information that you've collected, what are the data actually telling you as a result of your assessment? What have you identified? A, reinforcers for the client. Do preference assessments identify reinforcers? They do not. And why not? Because we're only identifying preferences. The only way we know if something is reinforcing is if it actually causes behavior to change. So preference assessments come prior to reinforcer assessments. So in this case, we're going to take those preferred items and then figure out, are they reinforcing? But as a result of this assessment, we have not identified reinforcers. What we've identified are potential reinforcers. So likely, right, the high preference items, we're going to start there in the reinforcer assessment to try to identify, are they actually reinforcing? Multiples or all preference assessments only identify potential reinforcers for the client. It's a very, very important distinction. What about C, aversives for the client? Well, we haven't done any aversive test, right? Just because they don't prefer it doesn't mean it's aversive, and aversive means they don't like it or it feels bad to them. We haven't done any of those assessments. Again, just because there's no preference doesn't mean it's aversive. And then D, punishers. Well, punishers have the same issue as reinforcers. Before we can know if something's punishing, we need to know, how does it change future behavior? We haven't done anything like that. we've only identified preferences, and the preferences are only considered potential reinforcers for the client. So what have you identified as a result of your assessment? Well, B, potential reinforcers for the client. As Lorraine drops her children off at school on Friday, the day before Labor Day weekend, she reminds them that they are going to visit their grandma this weekend, so they need to behave on their last day of school or grandma won't buy them any presents. What is Lorraine establishing? So we're looking at Lorraine's behavior. Let's start there. As Lorraine drops her children off the day before the weekend, she tells them, you're going to visit grandma, you need to behave, or grandma won't buy you any presents. So what is she establishing? Let's start with a bribe. Now, a bribe is essentially the opposite of a contingency, because with a contingency, you first have to see the learner engage in the behavior before you provide the consequence. The bribe comes the reverse. The consequence is already given. So let's say you get a candy bar for behaving. In a bribe, I'm going to give you the candy bar and then say, now you need to behave. So you've already gotten the consequence, which is why we don't use bribes. Because where's the motivation now to be on their best behavior? They've already gotten what they want. In this case, however, Lorraine says, you need to behave on the last day of school or grandma won't buy you presents. So before they get the presents, they have to behave on their last day of school. In other words, if you behave, you get presents. If you don't behave, you don't get presents. And a contingency is simply an if-then statement. If you do this, then you do this. First you do this, then you get this. Lorraine is establishing a contingency. It's not a contract, right? We're not signing anything, okay? It's simply a verbal contingency. If you behave, you'll get presents. If you don't behave, grandma won't buy you any presents. This is a contingency. Understand the difference between a bribe and a contingency, which is very often misunderstood. Understand why we don't use bribes, and instead we use contingencies. Why are contingencies better? Why are they more powerful? Why are they what we use in ABA? Excellent. Thank you so much for watching. Check out btexamreview.com for all of our study materials, including our combo pack and practice exams. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.